Welcome to Community Awareness. Welcome to Community Awareness. I'm your host, Donna Smith. Thank you for joining us today as we feature Catherine's Health Center located on Lafayette in Grand Rapids. And with us from Catherine's Health Center is Karen, the Executive Director.
Hello, Donna.
And Ron, the Development Director. Thank you so much for being with us today. We're eager to hear more about Catherine's Health Center and all that you do and have done throughout the years for our community. So if you would, Karen, tell us a little bit about the audience that Catherine's Health Center serves.
Okay, well, we're what you would call a safety net clinic, and so we provide free or very low-cost primary care medical services for people who are low income and or underinsured, and typically those are adults, usually between the ages of 19 and 64.
And they have to live within a certain geographical boundary?
Our target is the Kent County area.
So anyone really within the Kent County, all right. And how would we go about making an appointment or making sure if we qualify for your services?
Well, we have a website that you can go look at. It's www.catherineshc.org, and there's all information on there. Or if folks just pick up the phone and call 336-8800, and when they speak to the receptionist, they can explain what their situation is, what they need, and they'll be happy to find out if they're eligible.
So this is, when I say like a doctor's office, the services that are there, it's much like a health clinic.
It is a doctor's office. It's like a small primary care office.
All right. And how long, Ron, can you tell us that has Catherine's Health Center been in existence?
We've been around since 1996. The forerunner was a community health clinic sponsored by the health department. But when that went out of business, very quickly the folks in the neighborhood realized that people needed access to care. And so Catherine's popped up at that time in the basement of the St. Alphonsus Parish. We've since relocated into a much nicer clinic.
Okay, and are you affiliated with one of the major healthcare providers?
No, we're an independent 501c3 nonprofit organization. We do partner in a limited way with all of the hospitals in town.
All right, and the funding, then it's a 501c3, the nonprofit.
Exactly.
Where do your funds come from?
We're an independently registered nonprofit organization, so we're non-taxable. We take gift support, and the community has been exceptionally generous with us. So a good chunk of our support comes from individuals, companies, churches who are interested in helping the community really thrive in terms of its health. But we also do a lot of grant work, so we've been awarded a number of grants to help us provide services and to keep our focus.
All right, and that's the primary focus of your position, I believe.
That's my role, exactly.
Right, okay, and have you found that to be increasingly more challenging with the economic downturn in the past couple of years, or because of the need of the services you provide, have you seen an increase?
I think it's both. Catherine's just completed 2 years ago a remarkably successful capital campaign. Karen was at the helm and led that in a remarkably capable way, and there were a number of folks from the community who really came on board to endorse what we're doing at the health center, to generously share their own treasure, and to invite others to do that. So that was a remarkable experience. A number of those individuals and businesses have stayed the course with us because they're really pleased with what we're doing, pleased with the way we really put their gifts to work to address the health concerns of folks who simply don't have other access.
Well, I'm intrigued to hear that you service all of Kent County. Would you say, from the demographics that you have, the information that you have about that, primarily people from downtown, or is it reaching out to some of the suburban areas?
It's from all areas. Our largest group of people are from the surrounding 4 or 5 zip codes, but we do see people from all over Kent County.
Okay, and how is it that you go about advertising, getting the word out about the services and your availability?
We have not ever needed to advertise. The need is so great, and very much of our advertising is done word of mouth by folks who are already receiving services by us, and they will tell friends or family members, but also the local emergency rooms and some of the other doctor's offices, when they have someone who has a need and can't afford their services, will refer to us.
Okay, marvelous. All right, and tell us again your hours. What are your open hours?
We're open Monday through Friday, starting from about 8 o'clock until 4:30.
Okay, all right. Now you make use of the AmeriCorps and Vista workers. In what capacity do they walk alongside Catherine's Health Center?
We really use them very, very heavily. So right now there are 6 very active AmeriCorps members working with us in really all elements of our program. So on any given day they'll be introducing patients who come for their appointments and making sure that the patient flow is appropriate, that people are ready to see the doctor or the healthcare provider when they're there. We use a full-time AmeriCorps person to head up what we call our MAP program, which is our medication assistance program. What we find is that a lot of folks who can get access to us still don't have the resources to purchase the medicines that they may need to manage their health, say diabetes, for example. And so by coming back and working with our AmeriCorps volunteer, they can find whether there are some low-cost medications available to them, and if not, we can typically acquire the medications from one of the pharmaceuticals companies, and then we act just like a pharmacy, dispensing it to the patient. So that's a nice opportunity for an AmeriCorps volunteer. We also use them to coordinate our other volunteers. We have a very large number of volunteers who do a variety of tasks, ranging from helping out with our gardening program to teaching people better health practices. We can do things like stuffing envelopes when occasionally that needs to be done. So they really have a variety of, for the most part, very, very meaningful work that they engage in while they're with us.
So if someone were interested in serving in the volunteer capacity, what would be the route that they would take to contact you?
We have a volunteer coordinator. Her name is Lindy, and she can be reached at that same phone number, 336-8800, or there also is a link on the website to be able to do that.
Okay, Catherine's Health Center. All right, you talked about something now that just really piqued my interest, and that is healthy eating. And you said something, I believe a garden even.
Yes, yes.
Walk us through that. What does that look like?
That's great. Well, what we find is that a lot of folks in our area, and particularly in the neighborhood around Catherine's, which is what we think of as a food desert, it's hard for people to find healthy, affordable food in our area. Some can't travel easily. The public transportation system is good in the area, but not as good as it needs to be for people to get what they need. So we're finding that if we teach them that they can eat more cheaply, they can enjoy being outdoors, and they can use their harvest to feed their families, that's a win-win all the way around. So the city of Grand Rapids offers some gardening plots. We're hooked up with those. We also have some space right on our campus, just outside our clinic, where folks can come and plant edible things. So our plantings, our landscaping is really a mix of ornamentals and edibles. And we're just in the season now where that's all getting started.
Yes.
Then, when harvest time comes, we bring in a chef who says, okay, here's what you can do with these kinds of herbs. Here's what you can do with this kind of produce. Here's what a tomato plant will do for you. And here are ways that you can serve your family healthy, nutritious food at very, very minimal cost. And we have people coming in for cooking classes and just really thriving on that, because what happens is they engage and then they start to work with each other to say, well, I made this the other day. I made that the other day. And so health habits are improving and eating habits are improving, and it's really been a fun thing to watch. And that's headed up also by our AmeriCorps people.
Okay, interesting. And the thing is that those of us who live in the suburbs and who have access to some of the major shopping centers don't think about that. But if we were to go downtown and just look around and think, okay, if I lived in this neighborhood, where would I get my groceries?
Exactly.
And to realize the obstacles encountered. If I don't have transportation, if it's not within walking distance, how do I get that? Well, the mini mart might be just down there, but again, it's costly, and certainly the health
And very,
choices
very
are
overpackaged foods and highly processed with lots of sugars and salts and other unhealthy things.
So we need to be aware of that, those of us in the suburbs, and to realize the benefit of having the garden spots and so on. Yeah, absolutely. Okay, and also too, one thing that I've been exposed to recently is that sometimes people of lower socioeconomic haven't been taught to cook. If it doesn't come in a way that I can pop it into the microwave, just add water and stir, perhaps I don't explore that. So just to be taught, hey, you know, I can cook and this is good.
Donna, that's so true. And to see people that don't even put it in the microwave, but just, as you say, go to the mini mart and eat it right out of the package. Whatever's available, whatever they've got the money for on that particular day. So this really changes health habits and dietary habits in a really very, very good way. You're right.
Well, we have the health reform right around the corner with President Obama and the legislators who passed this. How is that impacting Catherine's Health Center and what you offer?
That's still rather uncertain in how the Affordable Care Act is going to play out in the state of Michigan. There's a certain part of it that was passed into law that will be implemented nationally, but each state has been given some leeway to implement certain pieces or not implement certain pieces themselves. And as of today, Michigan has still opted not to implement a number of things. Right now, Michigan does not have a Medicaid expansion piece planned, nor do they have a state-funded or a state-organized exchange. And so no one is really sure what this is going to look like in Michigan, but the way things are right now, there is going to be a large number of people who are not going to be covered, and of the lower income people who are under 133% of poverty, unless something changes, will not get access to health care the way it's going to be implemented in Michigan. So we're planning and preparing to be able to serve the low-income people in our community either way. Right now we can serve them when they do not have insurance. If they do have some kind of coverage, it will be a Medicaid type product, we will be able to continue to serve them too. So we've been making some organizational changes and positioning ourselves so that either way things go, we're prepared to continue to serve the patient population that we target.
Mm-hmm. I don't mean to push you in the corner with this, but ever do you turn someone away if they come and they have no coverage?
Only when we don't have space for them. And right now we are open again to taking on some new patients. We do that kind of in a controlled manner as we have spots available. We feel like it's very important once we've accepted a patient as our patient that we be able to serve their needs. So if we get to the point where we're going to be out 3 or 4 weeks for an urgent appointment, then we stop taking new patients until we have additional provider hours. So
those are heartbreaking situations, as you can imagine, because people are desperate for care, and we are committed to providing it. But we've been around long enough to know that we can't meet the whole need, and that's a sad reality. It, in a sense, translates back to the question about affordable care, because we see our role as one of increasing importance, whatever that system is. So as Karen said, she's really been very, very busy positioning us to be of service no matter what happens. And we know that there will suddenly not be an influx of providers to look after the folks that we've been looking after for some years already, or to look after the new folks who are continually coming into the system in need of health care.
Mm-hmm. Okay, so this is a challenge, something. Are you holding your breath, or how?
No, because whatever happens at 8 o'clock on Monday morning, we'll open up and continue to provide care. It's just how that is going to be funded. If Medicaid expansion goes through, the majority of the people we are seeing right now would have coverage through that. And so then we would have a little bit of revenue that was not totally dependent on philanthropy, because we'd be able to get reimbursement from Medicaid. As it is right now, the majority of our funds come from philanthropy. If the Affordable Care is not implemented completely in Michigan, it will continue to be that way.
Okay, all right, so you're moving forward in confidence, doing the very best that you can with the resources you have. Yeah, absolutely. All right, so some of the services, like a mammogram, is that something?
We have a very large women's health program, and we do that through partnership with the Women's Health Network of Kent County, where we are able to, for eligible women who are between the ages of 40 and 64, provide a screening mammogram and then either a pelvic or pap smear each year for them. And then we're also able, if there's anything abnormal detected, to help them through with the costs of diagnosis and treatment.
Okay, and that's done right on site?
We do we actually have the mobile mammography unit coming out to us every other month, so that we have sometimes that we're able to actually do that all on site. Otherwise, we do the physician exams on site, and then the women are referred to one of the local hospital mammography units where the program covers those costs.
Okay, and how about a pediatric?
We do not really see a lot of children, and that's for a variety of reasons. In Michigan, there's a pretty generous coverage for children who are otherwise uninsured called My Child. Very affordable, very easily accessible, and so when we target folks, we're targeting right now the folks who don't have anywhere else to go. So when we see children, we'll see children who are in transition, either newly uninsured, new to the community, new to the foster care system. We help them access that coverage and then help find them a pediatrician who is able to see them. That frees us to see people who have nowhere else to go.
Okay. I have to believe that there's many challenges that you encounter. I mean, some heart-wrenching stories, certainly times when you feel, yay, this was very good. Without breaking confidence, is there a story or two that you might share with us?
Oh, we see them every day. But one that particularly strikes me, and actually when I tell it, it still makes the hair on my arm stand up, is when we were in the old place, before we moved into the beautiful new clinic that we did 2 years ago, we were in the basement of a church, and we had 1,200 square feet in this tiny little basement, and it wasn't very beautiful, but the care was good. And one day we had a young father walk into the door with a little girl, and she was obviously sick. You could tell she had a fever, she could hardly talk, her throat was so sore. And it turned out she had strep throat and had had it for quite some time and had been sent home from school because she was sick and couldn't go back to school because she was sick, and the family didn't have funds to be able to take her into a doctor and get her treated. So he came in with her, and our doctor saw them, and very simple to diagnose strep throat, very, very treatable. And so the doctor handed the young father a prescription, and he just stayed sitting in the chair with his head down. And the doctor asked, is there a problem? And he said, I don't have the money to be able to pay for this. And we were able to give him a voucher, get that prescription. At that time, it was before they had the free antibiotics at a number of the stores, and it was a prescription that was about $8.70. And so we were able to get that medication for him, and we sent them off, and we kind of didn't think about it. Got a call a couple days later that, yep, she was better, and she was back at school, and then we didn't think about it. And several months later, the young father walked back in the lobby. He had a baggie in his hand with some crumpled up dollar bills and some change and a big smile on his face, and he walked up to the window and he said, I just got a job and we have some extra money left over, and I want to give this to you so that you can help somebody else when they have nowhere else to go.
Very meaningful.
Yeah, and it's very, very much our patients want to contribute. They want to be able to be part of the solution. And so very often we'll have them return to volunteer, return as mentors in some of our programs.
Marvelous. How about you, Ron? Do you have a story or two?
I'm remembering two. One briefly, we got a letter a couple of weeks ago with a nice note from a family saying, please use our gift as you see fit. We'll never forget the care that you provided for our mother years ago. And those things really always touch us because we know that we've touched a life then. Another is on the flip side of it, and that is a middle-aged woman came to see us, and she said, my daughter told me I should come here, that I could see somebody here. I've never had a mammography, I've never